Doc, is it working for you now?
I'm still, I think I'm supposed to allow some settings on my own
laptop. Okay.
So yeah, so that's what I'm just doing.
Okay. All right, Ruba is on. She will be there. Hi, Ruba. We can't see you.
Hello. Yeah, hello.
We can hear you, but we can't. No, okay. That's Mira. I can hear you.
Please give me a second.
What about me? No, okay, so Ruba, I can't see you. I can hear you, but I can't see you.
Yes, please come to the Una home bed.
Can you see me now? No, still. 1 second. Oh, okay. All right. Can you see me now? Yes. Okay. I can see you now.
Thank you. Sorry about that, I'm back.
Oh, it's fine. Okay, so Ruba, I think maybe Mira would start by sharing her story and all that, and then the doc can come in to like give his presentation and all the other medical stuff. Or how are you going? How did you plan on doing it? No, we can't hear you. You have to unmute. You are muted.
Yes, hello.
Sorry. What I plan to do is to introduce the doctor,
Okay.
and then I will introduce Mira, and then they can give us the information.
Okay. No, but who were you going to start with
I'll
after
read
the introduction?
profile. Say that again.
After the introductions, who would you want to start, Mira or the doc?
So I'll welcome everybody, and then I will introduce the profile of the doctor, and then I'll mention that we have a survivor, and I'll introduce Mira briefly, and then we can have the conversation. So I'll ask the doctor to, or probably Mira to share experience. Either way is fine.
Okay, all right, okay, no problem.
So which one do we prefer? Do we prefer Mira to
kick off?
Yes.
Yes, Doc, what do you think?
Yeah, I think so. I'm also still trying to see if I can share my screen.
Okay.
Yes, I think there are a bit of restrictions on me, so I think Mira can start for us.
If you don't mind, you can also forward your presentation to me. I could share it from my end, and then if you need to go to the next screen, you just let me know. I'll move.
Okay.
So that way we can.
Sorry about that.
Okay.
Mira, before we start, can you just pronounce the last name? Is it Coach Rain?
It is Wolf Cochrane.
Cochrane. Okay.
Yes, Wolf Cochrane. Yeah.
Okay. Thank you so much. Can we start now or should we wait for 1 more minute? I think it's by my time it's 1 o'clock. Just can you all hear me? Okay. Okay, I think I can start now. Good afternoon, everybody. My name is Rubaba Doseni. I'm the Deputy D&I with SPE Ghana, and I'll be your moderator today. Today, we are going to be discussing about cervical cancer and how we can prevent cervical cancer. Today in our midst, we have the renowned Chief Executive Officer of the Reach Medical Center, in person of Dr. Emmanuel Jima Amankwa. Dr. Emmanuel Jima Amankwa is a results-oriented CEO who is passionate about the healthcare of his community. His vision is to make quality healthcare accessible to all Africans and beyond. He is a specialist surgeon who provides surgical care to both public and private healthcare facilities all across Ghana. He is a 2013 alumni of the School of Science and Dentistry, Kwame Nkrumah University of Science and Technology. He's also a member of Ghana College of Surgeons and West African College of Surgeons. We are privileged to have him today to elaborate everything we need to know as women on cervical cancer, ways to prevent it, and what we need to look out for when we see symptoms of cervical cancer. Also in our midst, we have a survivor of cervical cancer in person of Miss Mira Cochrane. Miss Mira is married with three kids, one 21, 6, and 2 years of age. She has a degree in administration, focusing on human resources management, and she's a licensed senior cabin crew with African World Airlines. She is now the senior customer experience officer with African Airlines in Ghana. Ladies and gentlemen, I'm going to leave the floor to Miss Mira to please share with us what
Hi, Mira. Please, you can go ahead. I think Ruba is having some network issues. Please go ahead.
Okay. A very good afternoon, Ladies and gentlemen, I hope you can hear me.
Yes, we can hear you.
Oh, okay. My name is Mrs. Mira of Cochrane. I'm 37 years old. I've been a senior cabin crew for over 10 years. Started with Starbow and now with Africa World. My current position is a senior service and customer experience officer. I deal with service quality. Unfortunately, I had to go through this experience of being diagnosed with cervical cancer, and it was an interesting journey for me, and that has made me want to come out to speak with other people to know that no, cancer is not a death sentence, but if you act right and act now, you can save your life and also save somebody by educating them. So my journey with cancer started, I started experiencing symptoms. That is 2021 December. My whole symptoms started from 2021 December, and I started seeing glimpses of it earlier after my last baby. But I didn't attribute it to cervical cancer. So after my last baby, I started experiencing very painful periods when my menstrual cycle started again after the baby. Very painful periods. I went to see my doctor. He said, oh, it's nothing. Maybe it's just hormonal after, your hormones coming back, your menstrual cycle returning after the baby. Mind you, two of my last kids were through cesarean sections. So I was given some hormonal drugs. I took them. The next period wasn't as painful. So everything was fine. The third period from after taking the hormonal drug, these painful periods are back again. I'm like, what is happening? So I went back to the specialist again. He said, okay, let's do a pap smear. I said, okay, fine. We did a pap smear, but I started to see that I was having spotting in between periods. So we did the pap smear, and unfortunately, as soon as the nurse took the sample got some, I hear there were vessels gathered at the cervix, and then one ruptured and it got on the sample. They made it, the doctor said it was fine to go, it was good to go, it wasn't contaminated. Then the results came back, it was a negative. So that was in 2022 February. I took the sample 2022 February. Everything was fine. To me, I'm negative, so I'm going about my business. I'm still experiencing these spottings. So at a point in September, I said, no, this thing, it's not normal with me. Now I'm seeing discharges. I'm seeing having funny waist pains. I'm having a lot of symptoms. I bath and wash myself, and then there's blood spotting everywhere. So I went after my 37th birthday. That was on 4th of September. Then the Thursday afterwards, I started this spotting again throughout the weekend of my birthday. Thursday, I came to work. I said, no, I'm not okay because I've been bleeding for 9 days now. So I told my boss I have to leave. So I went straight to the hospital. I took an Uber. I left my car, took an Uber because I was feeling dizzy. I left straight to the hospital. Immediately I went there. They admitted me. They were trying to stop the bleeding. It wouldn't stop. They had to use adrenaline to stop the bleeding. They had to give me a blood transfusion at that time because my blood level was 7.1 at that time. So I had to be detained to be transfused. And then they monitored me till the next morning. I was booked to meet the specialist. on a Tuesday. I came to see the specialist and they used the speculum to look in there. And the first thing he said was, "I'm sorry, you have gone beyond the pap smear." I'm like, what is happening? Is this what I'm suspecting? Because in this day and age, when you are expecting certain things, we all go on Google and, go and find out what could be the problem. So I was suspicious of it already. And the doctor confirmed that no, he's suspecting cervical cancer. So he's referring me to another specialist who is concentrated in that field. So they referred me to Mary Lucy. And I went to see the specialist. We did the, I don't know, do you mind if I share my screen with you?
You can go ahead.
Okay. So we did a colposcopy. All right. So we did the colposcopy and through the colposcopy, they took samples to go and do a histology. That's the histopathology report. So they took several samples and then there you go. The results came in and they were confirming that yes, it was cervical cancer. That was at Mary Lucy Hospital here. Yeah. All right. So from there on, I was asked to go and have a CT scan. So I went to have a CT scan. Look for the suspicion was a locally advanced cervical cancer. So they went to do the CT scan. I went to Quest Imaging. And yes, so this is the results from the CT scan. And yes, it was a history of cervical carcinoma. The uterus appears otherwise normal. So they did the whole, checking of the abdominal area. And this was the results. So the appearance of the uterus in keeping with history of cervical carcinoma. So there, I'm sure doctor will explain better when he comes on, but yes. So from there, I was referred. From there, I did my a total abdominal hysterectomy. Luckily for me, I have kids already, so I did a total abdominal hysterectomy. They only left the ovaries for me. And this is after they took out the womb, they took it for another histology to check in the areas where the cancer was could be located for a better information. And it was noticed that it was endometrium. So this is basically what the results came in. Positionable. Sorry. Hello.
Yeah, please go ahead. We can hear you.
Okay, so yes, so this is the results of the second histopathology after the womb, the uterus was sticking out. And then this is the conclusion, yeah. Yes. So basically this is what came out of the womb being taken for histology. The further moment, I mean, I thought that mastering courage to go and do the surgery would have solved the matter, so I didn't think twice about it. I got the news, the confirmation on Tuesday, and Wednesday afternoon, I took my leave from work and I went to get operated on. And it was like a joke to my husband, but yeah, he couldn't believe it. Yeah. And I went to as at 5 o'clock, I was on the operating table. And then, we went through with it. So my thinking was that, hey, master courage, just go and take it out after all you finish having your kids. Take it out and get rid of it. The problem will be solved. Unfortunately, it didn't happen that way. The problem was not solved. So I went for my review with the doctor, and he mentioned that, no, I'm sorry, that's not where it ends. That he will have to refer me to go and get a further diagnosis on whether or not I will have to take a chemotherapy or radiotherapy. It was a blow. It was a huge. That was when I realized, oh God, this is happening to me, because I thought it was over with after the surgery. So that is the referral to me, and I was referred to Sweden Ghana Medical Center located at Ashalibotre for further treatment. So I went to see the doctor. He also wanted a further, diagnosis on the situation at hand. So he asked me again to go in for another CT scan again, which I also went back to Quest Imaging again. He wanted the scan to show something coming up a bit instead of just the abdominal. So I went to see them, and they did another CT scan again. This time it came up to the chest area to see if it had spread to the rest of the body. So they found some lymph nodes. They finding everything was normal, except they found some lymph nodes in the lower, the lower chest area. So I had to go. The doctor recommended that we do radiotherapy initially. That was yes. So this was where one of the problems that started this. No lymph nodes, right? The doctor looked at the CD and said, no, I see lymph nodes that are bigger than 2 centimeters. So we had to call these people again. And the doctor requested that they go back and look at my documents again, my charts again. And then they came back to confirm that, yes, the doctor was right, that there truly was a lymph nodes that were bigger than 2 centimeters. So we had to, he had to redo everything again. He asked me, he gave me 25 sessions of radiotherapy. 25 sessions. And so he had to expand the field of the radiotherapy to come to the upper abdomen area. And then I was given 6 sessions of chemotherapy. And then 3 sessions of brachytherapy. So we started everything Monday to Friday, back to back, doing radiotherapy. And then I started losing weight because I was, I started, having diarrhea, loss of appetite because of radiotherapy. So I started having a lot of diarrhea. There was loss of appetite. I couldn't eat. I couldn't keep anything down. I lost a lot of weight. Then I started my first chemo session in between every Wednesday. It was Monday to Friday radiotherapy, and then Wednesdays was chemo days. And I was supposed to do 6 of those. And I mean, the needles that have gone in my arm, even some on my feet, from this, when this journey started from surgery up, so there were times they couldn't even find a vein. They had to put cannulas in my feet just to hydrate me. We started chemo. Luckily, chemo wasn't too harsh on me. I didn't lose my hair and my hairs because my doctor gave me there's this drug they use, cisplatin. They use cisplatin. So he gave me cisplatin, unlike some of the breast cancer people that, you know, they get very, very harsh. This, and yes, this is my chemo, radio, and brachy bill just for treatment. In fact, I had a discount. It was more than that, but I had a discount. It's not a child's joke.
Are you sharing that
and,
screen?
Yes,
Yeah,
I am.
Your screen.
I can't really.
We can only see a snapshot of it. Maybe you can
Yes,
mention
you
the
can
price.
just see a snapshot of it, but not the.
So you need to double click it.
Yeah, you have to double click it. Then.
Okay. Please, can you see it now?
Not yet.
I've double clicked it. Yes.
Maybe it's taking time to load.
Yeah.
I mean, not to cut it off. Your story so far has been thought-provoking, and I mean, I know a lot of people who are watching and listening to you are also having some chills, because for you to have gone through more than 6 sessions of chemotherapy, it's a lot. And imagine the cost involved as well. I mean, I must say that your courage was really, really high, and it's something we should look out for and learn from you. However, let me go to Dr. and ask Dr. Mankwa. We've heard cervical cancer. Can you just tell us in plain words? We know it starts from the cervix. Can you just elaborate what this whole cancer is? We know that we can seek help because now we have a survivor in our midst, sharing her experience and all that, and how she went through the journey. I mean, this is not a smooth journey, but she was able to overcome the journey. Can you please elaborate what cervical cancer is, and as women, as men, husbands, friends, what we need to look out, and if we see any signs, what should we do? Thank you.
Okay. So thank you so much, Mira. I mean, when I see a survivor of cervical cancer, it's very heartwarming, because in being, unlike breast cancer and other cancers, you can see it before it advances. Okay. Cervical cancer is hidden until you start seeing some of the symptoms that you saw and you reported. Some wait for so long until it gets worse. But I mean, your courage to even go and have the surgery done, I think the following day. So I mean, it's quite impressive, because we have patients that we have to really counsel them for long, bring in a lot of support groups before they even agree to the diagnosis, then to now decide that, okay, let's have the treatments. So, I mean, you are really inspiring a lot of people, and myself, because I'm also in the field, and I'm hoping others would take a cue or two from you. So, before we start, I hope you can see my screen. I just made a shorter PowerPoint presentation, which would highlight everything that my moderator has asked me to elaborate on. So to start with, just to let you know a few of our services before we dive straight into our main topic. Matridge Medical Center, we are a primary healthcare facility, and we offer a number of services, and some include paternity testing. So if you have any issue with knowing for the male and females, it looks as if it's the men who usually come forward, but sometimes the females also need to testing at RMC. We also have a dental clinic which runs on appointment basis. We also runs on appointment basis. Then we have a 24-hour laboratory service. That one, any time of the day, even at midnight, if you need to do an urgent lab, you can come to Ridge Medical Center. We have a 24/7 pharmacy service, and we have dedicated pharmacists who are on call in case you have issues with even your drugs that you have, or you just want a drug advice. Our hotline is there, which you can call. We have general and specialist clinics. So here we have all the cadre of specialists. So we have the surgeon, we have the obstetrician and gynecologist. I'm sure, Mira, you met the gynecologist in your situation. We have the physician specialists, the pediatricians, and a whole lot of specialties that come in. RMC2, we want health to be very easy and accessible to you. So we have our pharmacy delivery services. All you need to do is just to call us. You can even take a picture of your prescription and we'll deliver the drugs to your doorstep. We also have other services such as the X-rays, where you can do your chest X-rays, ultrasound scans. It's also one of the services that we offer. And this is a luxury service that a few hospitals do, which RMC we do. We do therapeutic massages, facial cleansing, and most of the time we do it over the weekends for the stressful corporate workers who want some time off. We also offer that at Ridge Medical Center. And we have a number of private health insurances that we have subscribed to. So if you have any of them, you can access our services by, so we have Metropolitans, we have the ACE Insurance, Premier, Apex, Phoenix. So we have all of this, and we are even adding on more. Hopefully this year we'll add about 3 more to it. So, and our prices too are very competitive, and the hospital is a boutique concept, so that when you come here, you start getting well by seeing even our environment. Okay, so let's jump to it. So first, we want to talk about what is the cervix and what is cervical cancer. How serious is it? Who is at risk? What causes it? What are the presentations, the signs and symptoms? What are the treatments? What are the prevention? And we talk and conclude on our.
I think we're losing Doctor. Doctor, if you can position yourself.
So I hope my screen is very clear. We can see. Can you hear me?
It's clear now. We can hear you now. It's better now.
It's better now. Okay.
Thank you.
Yes. So as I was saying, at any point, if you can hear me, just let me know, so that I can adjust the network here is not so stable, but I think once you can see the screen, then we can go on. Okay, so the first question is, so what is the cervix? The cervix is what we call the gateway into the womb. So the cervix starts from where the vagina ends. So the vagina is the entry of the female genital system, and it passes through the cervix and into the womb. So there's the small area here, which we call the cervix, and that is where we have cervical cancer. We can also have cancer, however, the cancer can be of the endometrium, that is the womb itself, or it can be of the vagina itself. But the where we are focusing on is the cervix. Okay. So the next question is, how serious is it? Cervical cancer after breast cancer. However, worldwide, it is the 4th leading cause of cancer amongst women. Currently in Ghana, every year, there are about 2,797 women who are diagnosed of cervical cancer. of which about 1,699 of them die. And this is the statistics we are getting. This is the statistics of those who have reported. Is the second leading cause of cancer in women in Ghana. We have other situations where we've autopsy, then we find out that it was cervical cancer. So this is even the statistics that we are even getting because of those who have chosen to present to the hospital. Worldwide, however, about 500,000 women acquire the disease every year, and most of them are within our bracket, the developing countries. Okay, so that tells you how serious is it. It is. And what I said earlier on too, that place is hidden. So it's advanced before a lot of people report that they are having symptoms of the cervical cancer. So the next question is, who is at risk? It said that people who smoke cigarettes, either actively or passively, they are 2 to 3 times at risk of getting cervical cancer. Also, we talk of sexual activity in that an important and single risk factor, which is the human papilloma virus infection, what we call HPV, is a sexually transmitted infection which has been implicated in more than 95% of all cases of cervical cancer. So it is transmitted through sexual intercourse. So in women who have multiple sexual partners, who don't use protection and during sexual intercourse, for those who were also introduced to sex at a very early age, they are at risk of getting this HPV infection, which subsequently would lead to the cervical cancer. We also have conditions. So we say someone is immunosuppressed. People who have what we call HIV/AIDS, they are at increased risk of having cervical cancer. Those on taking what we call drugs that suppress your immunity. People who have done transplants, some people have autoimmune diseases, we are giving them steroids. Those who have been in it for long periods, they are also at increased risk of cervical cancer. Also, for those who take oral contraceptive pills, there's a relative increased risk for those who have taken it for more than 5 to 10 years. So they are also at increased risk of getting cervical cancer. Another group of people who also are increased risk of getting cervical cancer is women who don't also keep a good genital hygiene. It has been shown that there's an increased risk of getting cervical cancer. Then we come to this all-important and virus, which, as I said, has been implicated in 95% of all cases of cervical cancer. And it's called the human papilloma virus. The human papilloma virus has various types, okay? The same way we are all Ghanaians, but some are Akans, some are Ewes, some are. So the virus has different types, and some of them increases your risk of getting cervical cancer as compared to others. So we call those ones the various serotypes, okay?
Doc, I think you need to readjust yourself. Dr. Mankwa. So I think we're having a challenge with Dr. Mankwa. He's trying to readjust and probably he will join us soon. Doc, if you can hear me, I can still see you online, but ladies and gentlemen, I think we've lost Doctor. Let's give ourselves some 1 minute, and probably he will join us back. So before he joins us, Mira, did you get a lot of women coming up to you to share their experience, and were you able to also share your experience to a lot of women, and therefore they were comfortable going in for the surgery?
No, I didn't. But what I found comfort in was that information is out there online. So I did a lot of Google search. I used a lot of, Google search to take me to different pages. I read about, there was a particular somebody's experience. Please, can you hear me?
Yes, loud and clear.
Yes. So I read of a lady's particular experience, and it told me, okay, this is gonna be tough, but I have to brave it out, because I made up a choice that I'm gonna live for my children. My kids are too young for me to leave them. So I mustered courage. So immediately, luckily for me, as I'm glad doctor showed the screen of the insurance. My company, Africa World, pays for staff insurance for their staff. So we are on the Metropolitan Health Insurance, and they paid for my treatment. They paid for my, but even that thing I showed to you was just for treatment, non-inclusive for flaps and other medications I may need.
Oh, okay.
Non-inclusive of the surgery, which was about the surgery and its cost was about 40,000, non-inclusive of that.
Oh, wow.
Yeah.
There's a question in the chat box, by asking that, what are the side effects you've experienced after the hysterectomy?
Yes, so I didn't get any side effects. Seriously speaking, I didn't get any side effects. I think I'm lucky because I've had 2 cesarean sections. It wasn't something new to me to have a abdominal surgery. So I was able to do the right things to pick myself up quickly. In fact, I was back to work. As at after 4 weeks of surgery. They were sucking me out of this place.
Oh, wow.
Yes. There was no side effects at all. They left the ovaries.
Okay.
So I wouldn't fall into early menopause, but there was no side effect at all.
Okay. For more clarification, from the day you saw your results and it was confirmed that you have the cancer, and till the day you went for your surgery and the chemotherapies, how long was that for?
I got the results of the histology on a Tuesday evening, and I went home. I got home around 11:30. I went home to my family to go have to tell them that this is what had happened. We had a prayer, and then I went home to pack my things and told my husband, bring down my suitcase, pack my things. I'm sure he thought I was crazy, but the very next day, yes, I'm sure he thought I was very crazy. He asked me, are you joking? Is this a joke? So yes, the very next day, I came to work and put in a leave and drove myself to the hospital. 5 o'clock that evening, I was in the theater having my surgery.
Oh my God.
Yeah,
okay. So
I didn't stop to think that. I didn't stop to think that what is happening, or because throughout the period I was looking online and seeing people's stories and whatnot. And for me, I had made up my mind that this thing was not going to, bring me down.
Okay.
So that was I think doctor is back.
Okay.
Yes, so sorry. I think the network here is not as stable as I thought it would be. So sorry about the interruption.
That's fine, doctor. Please, you can go ahead.
Yes. So I was talking about the human papilloma virus, As I said, that it is implicated in 95% of cases of those who have cervical cancer. So it's a very important virus. But aside it causing cervical cancer, it causes other disease conditions. We want you to know the other disease conditions so that once you know you have such an infection, then you have a high index of making sure you are screening yourself against getting cervical cancer. So some people might have some of these disease conditions, but they are not aware it can progress to cervical cancer. So when we talk of the disease conditions, we have what we call the warts, which is one of the most common presentations of this virus, the human papilloma virus. Some of the pictures I'm showing, they have what these kind of projections around the genital region, either around the anal region, around the fingers. This virus can even cause warts within the mouth. So you can see someone's mouth opened with the teeth just down there. So you can see the warts at the corner of the mouth, the cheek. Then they can also have warts around the penile and the vaginal region. So anyone who has this condition, these pictures is just showing how warts look like, and they are caused by this virus. Subsequently, if the virus, people who are engaged in oral sex and they have persistent infections, okay, they can get what you call the throat cancer, that is oropharyngeal cancer. So this same virus can cause oropharyngeal cancer. So we always advise that people who even engage in oral intercourse, you have to make sure that you are checking the genitals of your partners to make sure they don't have anything like that, okay? Then aside that too, it can cause what we call the vulvar cancer. The vulvar cancer is the entry into the vagina, the skin fold over there, okay? That one can also lead to vulvar cancer, that is the HPV infection. Also, there's cancer of the penis. It's something that exists. So people who have HPV infections can also get cancer of the penis. Then for those who also engage in anal intercourse, also they are also at risk of having anal cancer. So all these conditions can be caused by the human papilloma virus. So whenever you see any of them, you make sure that you are checking yourself to make sure you're not getting any of the other. You don't have any of these conditions, which probably you are having an infection at your cervix, which could lead to the cervical cancer. And we come to presentation. I think Mira has really told us what she went through, okay? And hers was even in an advanced stage. There are some in which you don't feel anything, you don't see anything. That is the very early stage. That is why we usually recommend the pap smear. That is the reason why we usually recommend the pap smear, so that you are screening and you are constantly checking. I think Mira mentioned that she was having a prolonged menses. That is what we call the intermenstrual bleed. So some patients come, oh, my menses finished, and the following day it has started again, and it's so prolonged. You can't have your menses for the whole month. That is not a pathology. People can bleed and bleed and bleed. And as she said, she was anemic at the time she even went to the hospital because she has bled a lot. So they can have what you call intermenstrual bleed. So if you are bleeding for a prolonged period, your menstrual period is supposed to be just 7 days, and you are bleeding for 2 weeks, you have to come so that we check you and be sure that this is not probably the cervical cancer. Also, ladies come and they complain of having pain during sexual intercourse. It used not to be so, but recently, whenever they're having sexual intercourse, they notice that there's a lot of pain. That is also a sign of cervical cancer. And aside that too, after having sexual intercourse, they realize that they bleed. So maybe after sexual intercourse, they put on the underwear, they notice that there's some bleed that is coming. Some also complain of persistent pelvic pain. Always, they have a lower abdominal pain. That's also one sign. Others also complain of immediately within a short period, they want to go and pee. that is also a sign of cervical cancer. And there's pain that is associated with the pain. So you have to really watch some of these, and they look very subtle, but they are symptoms and signs that you realize that no, this is probably cervical cancer. So when you see anything like that, make sure that you quickly go so that we can check you out. Some also lose weight. Okay, those that are very advanced, they lose so much weight. Yes, I know, Mira, you've had your share, but I'm so glad to see you in this state. Some lose so much weight when it gets to the advanced stage. So I think Mira mentioned that hers was locally advanced. Okay, but we have what you call metastatic. When you talk of metastasis, it can go all the way even to your brain, to your chest, to your abdomen, everywhere in your body. Cervical cancer can be that extensive. So we don't want you to get to these late stages. We want to make sure that we get you at an early stage so that we can treat you appropriately. So the next question is, so how do we even investigate this? How do we diagnose it? The picture you can see on this side, this is showing the cervix. Okay, this is showing the cervix. You can see there's a normal part of the cervix. Then we come to the part where we talk about a low grade and we have a high grade. This is just showing you the grades at which cervical cancer progresses. It starts from low grade, high grade, and it comes to a full-blown cervix, cervical cancer. So when you come in, the first thing that we would do is, with the diagnosis, we always recommend a pap smear. A pap smear with or without checking whether if you have an infection, that is the HPV infection. And when doing the pap smear, I'll take us through that how it is done. A piece of this will be taken under a, we use a speculum through your vagina, then we visualize the cervix. Then we take a sample with a very fine brush. We also have what you call the colposcopy. I think Mira said she went through that. And for that, we look at the cervix, we visualize it, then we take a sample, a biopsy, and we take it to the lab for the histopathology. Other investigations that we do, we check your blood level because most of those with cervical cancer lose a lot of blood, so they are anemic. We check your liver function to be sure. In the very advanced stages, some of the women even have yellowing of their eyes. We call it jaundice. That means it has gone all the way into the liver. Your kidneys too can have issues when the cancer spreads along your urinary tract to your kidneys. So we have to check that too. We do a chest X-ray also to be sure if the cancer hasn't spread to the chest. These are some of the investigations that we do. And in a very advanced disease, I think Mira mentioned it, that we have to do a CT scan, there's MRI, there are a whole battery of, we really hope that we don't have to get there because I mean, these investigations too are also expensive. Yes. Now we come to the pap smear. We call this the life-saving smear because life-saving smear in that just 10 to 15 minutes, we can take a sample from you and be sure or not whether you have cervical cancer or not. So the process, this is what to expect for those who have not done it before. We'll let you lie on your back. Then you put your legs on what you call stirrups, just to open and part you up. Then the doctor will insert what you call a speculum through your vagina towards, that is the main uncomfortable part of this particular investigation that we do. So we put it in there, the speculum, and we open it up. Then we have a fine brush that we use to brush the surface of the cervix. Then we take it to the lab. Once we take it to the lab, then we look under the microscope to see if there are cells that show cervical cancer. Okay, so as I said, this is a very short procedure. Within 15 minutes is done. And we take it to the lab. Within about a week, you have your results. Then we know whether or not you have cervical cancer, either an initial disease or an advanced disease is present. Now we come to the treatment. So there are various treatments. If it is very early, Assuming we caught it at the pap smear stage, and we noticed it during this our what we call our speculum examination, what we call the cone biopsy. We just take part of where the lesion is and we take it completely off so it doesn't spread. We can also do what we call electrocautery, where we use what we call heat to burn out the cancer cells. And we also have what we call the freezing therapy, cryotherapy. Okay, in locally advanced, which was in the case of Mira, she had to go through the surgery, the chemotherapy, and the radiotherapy. So those are how we manage locally advanced. Unfortunately, for those that is metastatic, it has spread throughout the whole body, even into the brain. There's very little we can do. All we can do is to make your life more comfortable, because most of these people in advanced stage, they don't even live more than a year. It can be very, very terrible with the blood loss and so much. We don't even want to get there. So with that case, metastatic case, we only do what we call palliative therapy. Now we come to an all-important part, prevention. Prevention. How do we prevent this? We have what you call the HPV vaccine, which I'll take us through more on the next slide. The HPV vaccine is supposed to prevent you from getting the human papillomavirus infection, which, as I said, is implicated in 95% of those who have cervical cancer. We advise that women should keep a very good local hygiene of their genital regions, because it prevents them from getting this HPV infection. Also, it happens that for women who have sexually transmitted diseases, the drugs can be quite extensive. So some don't complete their treatment and they keep on getting recurrent sexually transmitted diseases. We advise that you have to make sure when that is diagnosed, you have to make sure that you are properly and fully treated so as to prevent it from progressing to a cervical cancer. Also, we advise that safe sexual practices, especially keeping to one partner, and also using of barrier protection, which is the condom. And we advise that if it's even every 3 to 5 years, make sure you have a pap smear check. Because once you are sexually active, you are likely, especially having unprotected sex, you are likely to come in contact with the human papilloma virus. And that virus is what can lead you to getting the cervical cancer. Now we come to the vaccination. So it's recommended around the world that the age in which vaccination should start should be between 9 to 26. In that we want to make sure that we vaccinate those who are not sexually active. When immediately you become sexually active, that means you are exposed to the HPV virus. So, and we are assuming that most women might become sexually active from the age of 10 going. So we have to start early with the vaccines. And the vaccines are supposed to prevent you from getting the HPV infection. There are various types of the vaccine, which I've listed some there. Some are 1 regimen, a single shot, some are 2 regimen, and some are 3 regimens. So based on what is available, which will be communicated to you by your care provider, so that you know exactly which one you are getting and the dosing. So all of that will be explained to you. So based on what is available, and that is a major issue, because currently in Ghana, we don't have any vaccination program for HPV. So that makes it so difficult for us to prevent this cervical cancer. There's no program like that. However, we advise that those who can afford it and have access to it, you try and take the vaccination. So in conclusion, I'll say don't let cervical cancer stop you, which Mira has really shown us. And we advise that you get screened regularly. As I said, we advise that every 2 to 5 years, make it a point to go and have your pap smear done. And if you get the vaccine, make sure you try and get it. It's good that we at Ridge Medical Center, we running this campaign, not only in January, we've extended it through February, and we are doing 20% discount on pap smears. So anyone who comes in, there's a 20% discount for any woman who walks in, but it's only up to the end of the month of February. Yes, so we want everyone to take advantage of that so that we can detect it early and treat it early. And if you don't detect it, you know how to prevent it also. So thank you very much for your time. And I hope I've been able to touch a lot of areas for you, but I mean, the floor is open. If you have any questions, I'm open to answer them. Thank you.
Yes, thank you very much, Dr. Amankwa. I think your presentation was well detailed. And one thing we need to focus on is the prevention, and also for us to come and get tested in regards to the pap smear. Please, if anybody has any question, please use the raise hand button, and then I'll call you. I'll let you ask a question. But before then, in your last slide, you made mention of the vaccine, and then you added the age group of 9 to 26.
Yeah.
Looking at the people in this on this Zoom meeting, we have a lot of people who have crossed the 26-year group. Is there a vaccine for people of that category who are above 26 years old? Since we do not have a campaign to the vaccine campaign in Ghana.
Yeah, so what I gave to you, these were a lot of international health organizations, including WHO's recommendation that between the age of 9 to 26, we try to vaccinate as much as possible. However, due to shortage of vaccines and shortage and expense of vaccines, they try to reserve it for that age group. Okay, but whoever is above that age group and you need to get vaccinated, because once you are sexually active and you have a risk of getting HPV, then you have to make sure you get the vaccine. But that was a recommendation, okay, from some of our health groups that, okay, let's try as much as possible to provide for within this age group. But those who are beyond, even if you are 40 years, once you are sexually active, okay, you have to get the vaccination so as to prevent getting the HPV and subsequently which could lead to the cervical cancer. And it is the same vaccine we give for all age groups, the same vaccines, either the 1 shot, the 2 shots, or the 3 shots, based on what is available on the market.
Okay, there are some few questions in the chat box. I'm going to read them and then you answer all the questions. But before then, I wanted to find out, for SPE group, a lot of us are working class women. And I want to find out if, because of our nature of our job, most of us are able to afford the vaccine. You as a doctor, are you going to advise that because we can afford to buy the vaccine, we should go for the vaccine? That's one. And then let me read the questions from the chat box, and then you can just lump all your answers together so that we can save some time. There's a question here that says that, what is the next step to take if you have been diagnosed with the HPV virus? And the next one by a gentleman here says that, does the screening, inspection, and diagnosis procedures affect one's virgin status if she was? And does the vaccine have any side effects? So those are the questions from the chat box, including mine that I just asked. If you can just lump those and give us an answer.
So, okay, so I think I just quickly scribbled something. So let me see if I've gotten off. So you're asking about the advice for vaccine.
Yes, that was the first one.
That was the first one. Yes, yes. And that is what we say. If you can afford it, we advise that you take it, because this is a lifelong protection. As I said, there are different types. We have the single shot. After that 1 shot, you are protected for life. Others 2 are 3 shots. And for that, you are protected for life. So we encourage people. Currently, the strategic group in WHO, we are hoping that West Africa, by the year 2030, all women, or at least 90% of women, will have this vaccine done, because 85% of all cases of cervical cancer resides in middle and low income countries, which we are part of that bracket. So we are now really promoting and preaching people to get the vaccine, okay? And as I said earlier, it is a cancer you don't see until it's advanced. So by the time you come and you get it, it's so advanced that it's difficult to treat. So we really advise that if you can afford it, try and get the vaccination, because it will go a long way to prevent you from getting this very bad cancer. Then I think there was a question on the next step to take if you've been diagnosed of the HPV, right?
Yes. Yes, that's it.
Yeah, so if you've been diagnosed of it, the HPV, as I said, there are various subtypes, okay? Some are cancerous, some are not. Once you are diagnosed of it, most of the HPV infection, they are self-limiting. It is the chronic infections that leads to the cancer. So once you know you have it, you have to make sure that you adhere to the preventive measures. One, you are keeping a good and clean genital region. Your partner is also checking themselves to make sure that they are not having the HPV infection, using of barrier methods to prevent transfer of the virus from yourself to your partner. But most of them are self-limiting, the infection. So once you know you have it, you first do your first check. After about a week or two, you do your next check. And once you are negative, you do the pap smear. Then you now plan for getting a vaccination done. So that is it for that question. But I think there's another question attached to this one. Hello?
Yes. The other question was, does the screening, inspection, and diagnosis affect one's virgin status?
Okay, that's screening and no. So based on the age that it is done, I mean, the main fear is that probably the hymen might be broken a bit. Okay, the hymen is the skin that is there before you have your actual vulva. So once that is broken, that is when you say someone has broken their virginity. However, we have very small speculums and other techniques to try and preserve the hymen so that it doesn't get broken. So we do it for very young people who are virgins too. Usually we say that, okay, the virgins are not likely to get the HPV infection. Okay, but the question is, are they also partaking in other risk factors that could lead to them getting, maybe smoking, that could lead to them getting cervical cancer? So we look at all of that and we say, let's still have the pap smear done for you to be sure.
Okay, another question in the chat box was that, is frequent urination a symptom of you having the virus?
Okay, so frequent urination is more in relation to you rather having the cancer. Frequent urination in general is associated with a lot of disease conditions. So it's difficult to say. If you have what you call a urinary tract infection, you have frequent urination. If you have diabetes, you have frequent urination. So we combine all those symptoms and the test. But as a woman, if you notice that this is something that is continuous, and we check you to see if maybe you have diabetes, you don't have, urinary infection, you don't have, but you still have a frequent urination, we get worried and we want to make sure that we are checking to be sure it's not cervical cancer. So frequent urination in isolation is not necessarily mean you have cervical cancer, but it is a symptom of it. So you don't wait behind until it goes bad. Once you see it, we have to find out what is causing that. Then we can rule out the cervical cancer alongside.
All right. Thank you very much, Doctor. I think this has been a very informative session. And like Doctor said, they are still giving out promotions for anybody who wants to do screening with regards to pap smear. The promotion is still going on till the end of February. And they also have other areas of specialty that they're also looking at, dentistry and the likes. So you can just go to Ridge Medical Center and mention that you're a member of SPE, and I'm sure you'll be given a discount in that
Yeah.
regard.
Yes, definitely. I'll just want to summarize with all the services. I just want to play a short video. Maybe those who didn't see all the service I presented.
Okay, sure.
In it, yes, so that you can appreciate what. Okay, so can you see my screen?
Yes.
So this is Ridge Medical Center.
Okay.
Your health comes first at Ridge Medical Center. Our team of doctors and nurses are highly trained healthcare professionals with decades of experience. And our staff are patient, friendly, and caring. We offer proactive treatments 24/7. Our pharmacy is stocked with only quality drugs and professional pharmacists. We also offer emergency care, laboratory services, recovery support, radiology, dental, eye services, and state-of-the-art surgical theater, which is well equipped to cater for various diagnostic procedures and so much more. Entrust your medical services to a team who cares. At Ridge Medical Center, we say your health, our reason. Locate us on the ground floor of the SU Tower, West Ridge, and contact us on 030-2235-269 for further information.
Yes, thank you so much. So that was just a brief overview of what we do at our end.
Okay, thank you very much. But before we round up, we just want to hear some final words from Mira, who has been a very, very great survivor. I mean, she has told us that as women, we can do it. We just need to muster the courage and go for it, seek for help. This can be cured and this can be done right here in Ghana. And she sought all the help in Ghana. And today she's right with us as if nothing has happened to her before. So Mira, I'm going to hand over to you to just give us some encouraging words to say that as women, we should fight because we have the fighting spirit and we can all come out in any situation we can find ourselves in.
Okay, thank you, Ruba. Yes, as she said, the fighting spirit, because it all starts from here. It's a mental thing. So yes, making a decision that you're going to go through this and get out of it. It helps a lot because that's to get to a point. That's the only thing that will drive you. Even if you have a good support system, even if somebody externally is encouraging you, if you yourself you are not encouraging yourself, it will be wasted. So I wouldn't want anybody to go through my experience. That's why I keep talking about it. So get out there, get tested, take the vaccination, so you wouldn't have to go through what I have been through. I mean, I have been lucky. My company's health insurance that they have paid for us, I'm with Metropolitan and they took the cost of my treatment, you see. So somebody may not be so lucky to have those resources to finance the treatments. And even that alone will weigh on you mentally, and it will not help your treatment process. So let's not even get to the treatment process in the first place. Let's prevent it so you don't have to think about something like this again. So I encourage each and everybody, go get tested, take the vaccination so that you can stay and live for yourself and your family. Yes, that's my final word. Thank you.
Thank you very much,
Thank you
Mira.
very much.
I think that's very encouraging. My last or final question to Doc, the vaccination, what's the price range? How much are we looking at for the single shot and the 3 shots? I mean, you don't have to give us a fixed price if you don't know, but probably like a range will probably help people
to work towards. I agree. It's actually quite important, you know, so that you prepare for it. So for the range, usually the single shots, based on the company, the type of vaccine, based on the company that makes it, the range is between 700 cedis to 900 cedis. That is for the 3 shots. So we have a regimen you follow. However, for those that have the single shots, it's also between the prices of 1,000 to 2,000 based on the manufacturer. And because we import it and our dollar rate, it has made the prices also escalate. So that's the reason. It's because of the cost of this that's making it difficult for even government to take it up and have a vaccination program, immunization program, because of the cost. Okay. So sometimes I tell people, well, I understand it's expensive, but sometimes you also have to think of the long-term effects. I mean, if the whole year you can save that amount to take the vaccines just for your life, I mean, taking care of yourself, I think, yeah, so why not? So that is the range anyways. Once you come in, we can see, and now we also know you as our partners. We're definitely giving a good discount when you come in for the vaccine.
So can I, so one last thing, as a medical practitioner, will you advise the women on this platform right now to say, you know what, go get the vaccination and you will be safe? Because we have had issues whereby being vaccinated for something you don't have, that does not necessarily, you know, become something that that's going to harm you. So are you going to tell the women on this platform in your best practice and say, you know what, go ahead and take the HPV shot and you are safe? I want a yes or no answer. Like
yes. Okay, so it is a yes. And just to buttress it with the point is that once you are ever going to get sexually active in your life, that means you are likely to get a viral infection, which is the HPV, and it's been implicated in 95% of cases of cervical cancer. So it is a yes. Once you are going to get sexually active, it is a yes.
Okay. One last question from Delali, and that will be the last question for this session. If you want further question, I think you have to book an appointment and see and seek information from RMC. She's asking that, can you take the vaccine after being diagnosed of the HPV?
No. So once you are diagnosed of the HPV, we are supposed to allow the infection to go off. So as I said, it is a self-limiting viral infection. So after the self-limiting viral, that's why after the first check, you come again in about 10 to 14 days. We check again. If the virus is gone, then we now give you the vaccine. We schedule a time and give you the vaccine. But once you're actively infected, we don't give you the vaccine. No. Okay.
All right. Thank you very much, everyone. If you don't mind, you can share the video, the RMC, and then we can post on our SPE platforms after the program. I'm sure Shina will get in touch with you in that regard. Ladies and gentlemen, this is going to be our the final session with Dr. Amankwa. I want to thank him so much for taking time out of his busy schedule to talk to us about cervical cancer, the preventions, the symptoms, and the likes with regards to, and also the vaccination, what we need to do as women who are most likely exposed to this virus is that the help is out there. Don't be shy. Mentally, you have to be strong. Mira said that, and she's been able to survive it. So we have an inspiration in our midst today, and who has shared a wonderful journey with regards to she surviving the cancer. And we are happy for her life, and we thank God for her life for being in our midst to be able to even tell us what to do once we see any sign or symptom of it. We want to say a very big thank you to you all for attending and for listening throughout the session. We hope you enjoyed and you've learned something out of this session. So without wasting much of our time, I'd like to say thank you very much once again. And I'll mention, I have some few announcements for SPE members. We have our student congress coming up from the 3rd to 5th of May. And we also have a beach cleaning activity on the 25th of February at the Sakumano Beach front, where we come together as SPE members to clean and contribute our part to Mother Ghana. Thank you very much for your time, and this is the end of today's session. Thank you.